For you, because of your heart problems, this is quite a risky procedure.
Okay, I understand.
When Swiss national Rudi Zuset, who lives abroad, learned he needed heart surgery, he didn't go home for the operation. He went to Singapore. The Asian city-state of 4 million, where everyone has access to healthcare, is famously healthy.
Singapore surpasses the United States in most measures when you look at the health of society.
Life expectancy in Singapore is 82 years compared to 78 in the United States. And Singapore is achieving that success in a cost-effective way. The US spends nearly 17% of its gross domestic product on healthcare. By contrast, Singapore spends only 4%, yet its healthcare system is widely regarded to be one of the best in the world. So how does Singapore do it? American Dan Snyder worked in US healthcare before taking over a hospital group in Singapore. He says the Singapore system works through a combination of quality care and a compulsory national savings program called MediSave.
Throughout your working career and your life, you're paying into a fund. That fund then grows in value over time, and then you use those resources to pay for health care.
Between 6 and 8% of every Singaporean salary is automatically deducted for MediSave, with employers also paying a smaller amount into those same individual accounts. While the government heavily subsidizes healthcare through taxation, patients are expected to make hefty co-payments, some as high as 20% for medical services.
So there's a bit more responsibility on the part of the patient to understand and be accountable for their selection for health care.
Singapore's system emphasizes personal responsibility. Because it's your money, the thinking goes, you'll spend it wisely. And providers are less likely to perform unnecessary procedures when patients, not insurance companies, are paying the bills.
It's the same. I gave the example of a motor car repair workshop. The first question the mechanic will ask you is, are you insured? If he knows you are insured, well, you do a lot more things than what is necessary. In medical circle, we call that over-servicing.
It's consumer-driven healthcare that encourages hard work and clean living.
So my MediSave is mine. Your MediSave is yours. I work hard, I earn more, my MediSave is bigger. You are lazy, you work less, your MediSave is small. I keep myself healthy, I hardly use it, I don't go to the hospital, my MediSave grows. I could not be bothered, I smoke, I drink, I'm obese, I don't exercise, I fall sick often, my MediSave get depleted.
But I don't think Singapore can afford to be lazy. Yes.
But MediSave funds are largely restricted to hospital costs and can't be used for outpatient services like those provided by Dr. Wong Chek Wei. He runs a small clinic just outside the city where his patients must pay cash. About $20 for this visit. Rang Zed is here for a persistent headache. But a bigger headache, he says, is his mother's medical bills.
We go to dialysis monthly, weekly 2 times.
She worked off the books as a street merchant and never paid into MediSave. So Rang Zed is paying out of his own account for her dialysis, about $250 a week. Now he worries about depleting his own healthcare savings. It's a common complaint.
Talk to anybody in Singapore. I mean, everybody is worried, and if you ask them if you were to have an operation or any major illness, do you think you have enough? Most of them will not be able to answer with confidence, yes, I have enough.
And though supplementary health insurance is available, it's not a popular alternative.
Most of my patients, they don't buy medical insurance apart from their own MediSave. In the Asian society, a lot of time they rely on family support and things like that. Yeah. So if I fall sick, we have not enough, I'll go to my next of kin.
The government does provide a safety net for those who haven't saved, but some say that the poor are less well served by the system. But because of the compulsory savings scheme, the concept of millions uninsured doesn't exist in Singapore.
Where hospitals are open to all, rich or poor, and we heavily subsidize them. So we have less of that kind of a problem that you face in the States. And precisely because of that, we are beginning to see some American patients.
A hysterectomy in the US costs $20,000 on average. In Singapore, it's $7,000. A hip replacement in the US costs $43,000 compared to $12,000 in Singapore. A heart bypass, $127,000 compared to $22,500 in Singapore.
For 170 million Americans, healthcare is delivered through private insurance companies such as United Healthcare, Aetna, others. 30% of the healthcare premium that's paid to that company goes to administrative overhead costs or administrative processing costs or the profitability of the company.
Could the Singapore model work in the United States?
I hesitate to say yes to that because healthcare is so politicized. There are now so many interest groups. It makes your reform even more challenging.
But Dan Snyder thinks reform is inevitable.
The United States needs a national health plan. There are too many CEOs of healthcare insurance companies that are making hundreds of millions of dollars delivering insurance when those dollars, in my opinion, could be better spent providing health to the population.
I'm Daljit Dhaliwal for World Focus, reporting from Singapore.